Welcome. I'm Rukma and you're watching Tracking COVID-19, a special half-hour show in which we tell you all the developments on the coronavirus pandemic. We also get you inputs about steps taken by the administration, inputs from our reporters on the ground, global developments and experts' advice, all packed together in the next 30 minutes. And let's begin now with top updates. Prime Minister to hold video conference meet with chief ministers today. This will be the PM's third video conference with CMs in the wake of COVID-19 situation. The meet is likely to discuss the issue of lockdown to contain the spread of the virus. Government assures there is no community transmission of COVID-19 in India, but asserts awareness and alertness a must. Number of active cases in the country up to 6,565 with 239 fatalities. 642 people are discharged after recovery from treatment. Centre says India has enough stock of hydroxychloroquine. Additional supply also tied up, says domestic requirement to be the priority while taking calls on export of the drug. Assures there is no dearth of N95 masks and PPEs in the country. Ministry of Home Affairs directs states and union territories to ensure strict compliance of lockdown measures, not allow social or religious gatherings. Ministry exempts operation of fishing and aquaculture industry from lockdown restrictions. Punjab government extends curfew in state till the 1st of May. Health Minister Dr. Harshvardhan interacts with state health ministers to review the situation arising due to COVID-19. Finance Ministry says government under process of releasing 12 million metric tons of food grain in 3 months under Pradhan Mantri Garib Kalyan Anna Yojana. And World Health Organization warns of the possibility of deadly resurgence if stay-home restrictions are lifted too quickly, as global death toll due to coronavirus goes past 100,000 with more than 1.6 million cases registered worldwide. And in tracking COVID-19, let's first take stock of the developments in India on ground zero. The number of active COVID-19 cases in the country now stands at 6,565, according to the Ministry of Health and Family Welfare. 239 fatalities have been recorded and as many as 642 people have been cured and discharged, while one has migrated. The central government has exempted the marine and fishing industry from lockdown restrictions. Along with this, the government has also provided exemption to activities related to trading of fish. Although the centre has stressed that social distancing and cleanliness be maintained while carrying out the trade in order to stop the spread of COVID-19. The central government under the Pradhan Mantri Garib Kalyan Anna Yojana is in the process of releasing 12 million metric tons of food grain during April and June. The finance minister has tweeted that the government will provide for 80 crore people food grain of 5 kg per head per month at no cost. Free ration has already reached 2 crore beneficiaries. With the rising number of coronavirus cases in the country, the armed forces have come together to fight the invisible enemy. In addition to the CRPF and the police, the Indian Air Force is working shoulder to shoulder to supply essential goods to every citizen. In this fight, the Air Force's C-17, C-130, IL-76, AN-32 and Dornier aircraft today dropped essential loads in Mumbai, Bangalore, Guwahati and Leh. Along with this, it also shifted army doctors from Lucknow to Guwahati. The Air Force is continuously working around the clock to ensure that items such as medical supplies and equipment, disinfectants and medical samples reach the desired destination to assist other professionals to fight against the virus. The government's official fact-checking entity has debunked media reports which claim that the Ministry of Railways has issued protocols regarding passenger travel post the lockdown period. The PIB fact-check team tweeted that such claims are speculative and misleading. No such protocols have been issued by the government. The PIB also dismissed media reports of shortage of hydroxychloroquine for Mumbai doctors dealing with COVID-19. The PIB fact-check team termed the report as fake. News Broadcasting Standards Authority of India (NBSA) has issued an advisory to news reporters and agencies with respect to the interview of persons in isolation due to COVID-19. The independent adjudicating body of news broadcasters has advised all reporting units of COVID-19 not to enter hospitals or isolation wards where COVID-19 positive cases are being kept in isolation to contain the transnational contagion. It also advised not to interview medical personnel so as to not jeopardize other lives in the country. Amid a growing tally of COVID-19 cases in India, people who have recovered from the disease have expressed gratitude to doctors. These corona warriors are urging people, moreover, to stay at home.
मुझे बहुत अच्छा लग रहा है, यहाँ से खुश होकर जा रहे हैं हम घर हमारे परिवार के लिए बस बिल्कुल अच्छा लग रहा है हमारा
यहाँ पे हमारा बहुत अच्छा ख्याल रखा गया है पूरी डॉक्टर की टीम द्वारा नर्सिंग स्टाफ बाकी पूरे हेल्थ प्रोफेशनल्स द्वारा
बहुत अच्छा लग रहा है यहाँ के डॉक्टर ने बहुत सेवा करी है हमारी बहुत ध्यान रखा है और हमने इस बीमारी से जंग जीती है आप अपने घरों में रहिए अपना ख्याल रखिए और सब सुरक्षित रहिए अपने घरों में
In a step to contribute their part or to do their bit for the nation's fight against COVID-19, Panchayat Burthia of Kathua district passed a resolution to skip one-time meals so that it can be distributed among the needy during the lockdown. In the panchayat of around 2,500 people, pregnant women, children, the elderly and sick are exempted from the resolution. The Union Territory of Ladakh is shifting gears in the fight against COVID-19, treating the positives, testing the symptomatics, effective implementation of the lockdown and making people adhere to restrictions by the administration in order to contain the spread of the deadly virus in the region are the strategies here. The Union Territory of Ladakh's Health Secretary, Commissioner Rigzain Samphel, has said that Ladakh has set up COVID-19 hospitals in Leh and Kargil with all necessary infrastructure. On procurement of essential commodities, Divisional Commissioner Secretary Saugat Biswas said that the Union Territory's administration is also procuring fuel, essential commodities and vegetables to distribute to the public during the lockdown.
But then also the credit goes to the leadership of the Honorable Lieutenant Governor, who's been reviewing this every day for at least 2-3 hours. Then obviously the public have been very cooperative. All our strictures of social distancing and confining themselves to the home, those have been actually followed, and this wouldn't have happened without the support of the public.
Air Force के हवाई जहाज़ों के ज़रिए से अब तक सब्जी और दूसरे एसेंशियल कमोडिटीज़ जो है दिल्ली और चंडीगढ़ से लाते रहे हैं और डेली कुछ ना कुछ हमारा सामान आता जा रहा है. सो वैसे भी लॉकडाउन ना भी होता तो भी अभी जो जिला बंद है तो दूसरे किसी और जरिए से आ नहीं सकता था सामान, तो वो सामान आ रहा है, लोगों में डिस्ट्रीब्यूट हो रहा है. तो जो ऑटोनोमस हिल डेवलपमेंट काउंसिल्स हैं ले और करगिल के, वो डिस्ट्रीब्यूशन में हमारी बहुत मदद कर रहे हैं और मर्चेंट एसोसिएशन है, कोऑपरेटिव डिपार्टमेंट है, दे आर एक्टिवली इन्वॉल्व्ड इन प्रोक्योरिंग द मटेरियल एंड सप्लाइंग द मटेरियल एट far off places.
And in Uttar Pradesh's Muradabad, migrant workers in shelter homes are being provided yoga classes in order to keep themselves healthy amid the outbreak of COVID-19. Social distancing is also being maintained during the classes. In Bhopal, the Smart City office in the city has been converted into a war room to combat coronavirus in the city. The War Room provides and records information of suspected COVID patients in the state. A sub-divisional magistrate has been given the task to acquire feedback on the treatment of those infected and inform the administration on their medical condition. Meanwhile, a data center has also been set up for compilation of data on treatment of coronavirus infected people those quarantined or kept in isolation. In a major relief for the poor and the needy, funds have been allocated to beneficiaries' accounts under Pradhan Mantri Garib Kalyan Yojana and other schemes in Shivpuri district of Madhya Pradesh. To aid the process of clearance of funds, several camps are being organized at the Gram Panchayat level. These camps are efficiently aiding the beneficiaries in withdrawal of deposits, keeping in mind social distancing. People have been instructed to maintain adequate distance from each other as the beneficiaries stand on designated circles and wait for their respective turns. Fully cooperating with them, bank officials and employees are also taking precautions regarding the spread of coronavirus. Again in Madhya Pradesh, the government is making arrangements for food and shelter of workers and the poor who have arrived in the state from other states and cities. Arrangements are being made for such people to stay at Rain Baseras and other shelters in the capital Bhopal and to give them food through Deen Dayal Rasoi. These kitchens are working at 4 places in the city and providing food zone-wise to the poor and the helpless. In charge of the Deen Dayal Rasoi, 6,000 people say that 6,000 people are getting food through the kitchens per day.
भोजन वितरण का हम जो कार्य कर रहे हैं, सुबह हमारी रसोई 6 बजे चालू हो जाती है। हम यहाँ पर करीब 5,000 लोगों का 6,000 लोगों का भोजन तैयार करते हैं एक टाइम का, जो यहाँ से डिस्ट्रीब्यूट होता है। हम सारे जोनल अधिकारियों को खाना वितरण करते हैं यहाँ से, फिर वो लोग वहाँ से उनके जोन से जो एरिया आते हैं, जो गरीब रुके हुए हैं, जो लेबर रुकी हुई है, जो बाहर से आई है और जो गरीब फुटपाथ पे रह रहा है, असहाय लोग रह रहे हैं, उनको भोजन वितरण करती है वो टीम। जहाँ तक है पूरा शहर कवर कर रहे हैं। शहर में हम कोशिश कर रहे हैं कोई भूखा ना रहे, ना कोई बस्ती रहे, ना फुटपाथ पे रहने वाले लोग, जो लेबर रुकी हुई है वो, जो ट्रक ड्राइवर फंसे हुए हैं वो, भोजन सबको वितरण हो रहा है।
And not only the center, but state governments are also taking every possible initiative to combat the spread of COVID-19. Police in Jangleshwar region of Gujarat are using drones to monitor lockdown rules are followed in the state. In Karnataka, Kalaburgi City Corporation organized a health checkup of camp for sanitary workers who are also the frontline COVID-19 warriors. Just like doctors, these sanitary workers were also being advised to take necessary precautions in order to protect themselves from getting infected. And as entire India battles with COVID-19 along with the rest of the world, multiple efforts are being made by the Indian government to raise awareness. Social activist M. Prabhakaran has also done his part to spread awareness about the disease. The artist painted a colorful image of the virus on the road so that every time passers-by look at it, they remember to take the necessary precautions to ensure protection from the deadly virus. And in Uttarakhand, police are keeping a vigil on every activity across Dehradun. Drone cameras are being used to monitor the lockdown situation and ensure that people stay at home. And now on to stories from across the globe on tackling COVID-19. More than 1 lakh people have died worldwide from coronavirus, with nearly 70% of all fatalities in Europe. Data compiled by Johns Hopkins University showed the global death toll at just over 100,000 and the number of confirmed cases worldwide at more than 1.6 million. More than 3,72,000 recoveries have been recorded. Italy has registered the highest number of COVID-19 deaths, more than 18,800 as of Friday, while the US has reported the majority of confirmed infections, nearly 500,000. However, the number of newly hospitalized patients in the hardest hit state of New York has dropped to a 1% increase. And the World Health Organization has warned countries on Friday to be cautious about lifting restrictions introduced to curb the spread of coronavirus. Director General Tedros Ghebreyesus has said that WHO would like to see an easing, but at the same time, lifting restrictions could lead to a deadly resurgence. He said there had been a positive side of slowing of the epidemic in some European countries, including Italy, Germany, Spain, and France. However, he mentioned that there had been alarming acceleration in other countries, including community transmission in 16 countries of Africa. And meanwhile, the United States becomes the first country to record more than 2,000 COVID-19 deaths in just a day. The total number of fatalities there has nearly amounts to nearly 18,000, with total number of infections over 5 lakhs. New York, the epicenter of the disease in the US, has registered more than 7,000 deaths and over 1,70,000 cases, which surpass Europe's worst hit Spain and Italy's infection toll. Meanwhile, President Donald Trump has said he sees the downward curve very strongly in New York. And a lot of that, he says, has to do with the aggressive strategy in saving so many lives. He also said that he would soon set up a new advisory council of doctors and businessmen to recommend when to open America, whose economy has come to a grinding halt due to the pandemic. More than 95% of the country's 330 million population are under stay-at-home orders as part of measures to protect people from being infected. In Poland, to ensure that basic facilities reach everyone, 7 vending machines that dispense face masks, gloves and sanitizers have been installed on the streets this week, and an additional several dozen of them are being planned to be installed soon. The move, which is being much applauded, comes after Poland extended its lockdown measures such as closing schools, hotels, restaurants, shopping malls, cinemas, as well as parks and promenades to contain the spread of the virus. As of now, 5,742 people were infected with the virus in Poland, with 175 dead. Italian Prime Minister Giuseppe Conte has refused to bow to business pressure and has extended the Mediterranean country's economically crippling lockdown until the 3rd of May. The announcement came after Italy's COVID-19 toll climbed by another 570 fatalities to 18,849, which is more than any other country, but with the growth rate now just a fraction of what it was a few weeks ago. Spain has shown a record 4% low in the death toll since the last 17 days, with 605 people dying from COVID-19, taking the death toll to 15,843. The rate of infection has also slowed in the country, with 4,576 new cases over the past 24 hours, with the number of those infected standing at 1,57,022. And some health tips on our segment, Doctors Speak. The Ministry of Health and Family Welfare has released a video to tackle mental stress, anxiety, depression and ways to cope with the stress amid the virus-induced lockdown in the country. Let's take a look.
So in this changing times of COVID-19, when we are actually having 2 important things happening in the world. One is the television showing us the increasing number of cases, and secondly, the issue of lockdown, where we are having to stay indoors and spend a large amount of our time inside the house with this fear of something that may happen to us, it's natural that there will be stress and anxiety.
The bodily symptoms include either restlessness or increased sweating, dry mouth, difficulty in breathing, palpitation, whereas the mental symptoms that happen in stress includes excessive worry, inability to concentrate, inability to focus on one thing. We need to train our mind to do other things so that we can manage better. And these things include things which are of positive coping, which essentially means if you are watching the TV, watch other entertainment. Talk to your near and dear ones. In the house, do some activities. For example, play games, read storybooks. In the same way, we need to manage our body and our physical health better to manage the stress. So either it can be home exercises or it can even be meditative exercises in form of yoga. For sleep, it is essential to maintain sleep hygiene because most of the days we are at home. Now, depression is slightly different from anxiety in a way that it's characterized by a sadness of mood, a feeling of worthlessness. Hold on to hope that comes by looking at our near and dear ones and by doing certain basic things. For example, exercises, forcibly doing household chores, forcibly talking to others, forcibly distracting yourself. Finally, in depression and in anxiety, when things are severe, don't go for substance use as a method of coping or don't self-medicate. And in case of emergency, seek proper medical consult or proper mental health consultation.
Do take care of yourself, and when I mean care of yourself, I mean both physically and mentally. I wish you all a good physical and mental health.
And as people are forced to stay indoors during the lockdown with a surge in COVID-19 cases across the country, the Ministry of Health and Family Welfare released a video explaining how to stop alcohol consumption and ways forward to handle the repercussions in a healthy manner. Let's listen in.
So in this lockdown period, if one is used to taking a large amount of alcohol daily, or is, in my word, hooked on to alcohol or is dependent on alcohol, then this can be a trying time for these individuals.
Some of us who are using alcohol on a regular basis, say daily or almost daily, may experience some discomfort, either physical or psychological. Psychological discomfort would manifest in form of anxiety, restlessness. The physical discomfort would manifest in terms of palpitations, breathing difficulties, tremors of hand, not able to sleep at night. Try to make yourself busy by watching movies, by watching television, by spending time with your family members or children. Indulge in some activities like gardening or exercising. Remember to drink lots of water during this time. Have a fitful sleep for 8 to 9 hours. That will make you feel better. However, if you have physical discomfort, remember that this can escalate to problematic kind of discomfort symptoms like seizures or delirium. You need to take help of doctor during such times, and the doctor will prescribe you medications which you have to take under the directions as the doctor has advised you.
But I would also say that this is a good time to trying to see how you can give up your addiction to alcohol, for the simple reason that it will cause more harm than good in the long run.
And that's all we have for you in this edition of Tracking COVID-19. Thanks for watching. Namaskar.